Hello everyone, we are the BSMLS Pages Group 5, and today we will be presenting to you our case of a 61-year-old male with a diagnosis of malignant neoplasm of the bronchus. In other words, bronchogenic carcinoma. So let's start off with examining the CBC result of the patient.
So in the table shown on the screen, you can see the CBC results. As you can see, there are two reference ranges, Henry's and Rodak's. We placed the reference range from Henry's 23rd edition as instructed, and since Rodak's reference range is commonly used in class, we also placed it for reference. But rest assured, both reference yields the same interpretation of the result. Okay, so now let's check each of the parameters' values. So for easier navigation, I will just be stating the numerical value since the unit is already shown on the screen. So for the WBC count, it's 35.5. It is elevated since it exceeded the upper normal limit of 11.3. The RBC count of 6.87 is elevated since it is more than the upper normal limit of 5.9. The hemoglobin of 211 is also elevated by exceeding the upper normal limit of 175. The hematocrit of 59.1 is elevated since it exceeded the upper normal limit of 50.4. For the RBC indices, the MCV is normocytic since it fits the 80 to 96.1 range value. The MCH is normochromic since it coincides with the range of 27.5 to 33.2. The MCHC is also normochromic since the 34.9 is included in the range of 33.4 to 35.5. So based on the results of the MCV and MCHC alone, the blood picture is normocytic normochromic. Lastly, for the platelet count, the value is 313 and is normal since it fits the normal range. Now that we have interpreted the values according to the CBC results as is, the real question is, should these results be valid for reporting?
Our group decides that no, the CBC results are not valid for reporting. But why? We have three main reasons. First, let's take a look at the hemoglobin results. As you can see, it is very elevated. Now, there are some reasons as to why this is the result. Some reasons why the hemoglobin is elevated may be due to the hemoglobin derivatives or carcinogen exposure. Going back to the patient's diagnosis, bronchogenic carcinoma is commonly caused by smoking. Smoking in turn causes high hemoglobin levels because of the hemoglobin derivative. Hence, if the patient's diagnosis is due to smoking, the increased hemoglobin result is not normal, but it is expected. Thus, it is valid for reporting. Also, if the bronchogenic carcinoma of the patient is due to carcinogen exposure, which is another top cause of bronchogenic carcinoma, then the hemoglobin level is also expected to increase. If, for example, the patient has been continuously exposed to silica, hence it may lead to fibrosis and can cause high hemoglobin levels. However, if we consider that the patient has no history of smoking or carcinogen exposure, this may indicate an invalid increase in the hemoglobin level. Thus, a further investigation is needed since it may possibly be a discrepancy.
During our discussion, we also noticed the inconsistency of the result of the hemoglobin, hematocrit, and RBC indices. Since there is a drastic increase in our patient's hemoglobin and hematocrit value, we think that our RBC indices have a possible discrepant result. As discussed in our lecture, any abnormalities concerning the hemoglobin will result in the abnormality in the transport of oxygen. So how come our patient's RBC indices are in the normal range, which are normocytic and normochromic? So with this, we conclude not to report the result because of the possible errors in the RBC morphology. Increased hemoglobin result should increase MCH and MCHC values, or should result in a hyperchromic morphology. Also, the increased hematocrit level should increase the MCV value or result in a macrocytic morphology. With our values showing inconsistent result, our group decided not to report and recommend doing a peripheral blood smear. To further explain the errors regarding the RBC indices of the patient, we go to the next slide because it is somewhat related.
Before anything else about this slide, first, we should know that when using either automated or manual methods in analyzing the specimen, A quick visual check of the result of HB and HCT can be done by applying the rule of 3. If the red blood cells are normochromic and normocytic, the HCT should be around 3 times the hemoglobin value. So back to our patient's results. Since our RBC indices show a normocytic normochromic RBC morphology, we used the rule of 3, and our group found out that our rule of 3 is actually invalid. For the calculation, we converted the hemoglobin unit from 211 grams per liter to 21.1 grams per deciliter to make the rule of 3, since 21.1 grams per deciliter of hemoglobin times 3 is equal to 63.3. The hematocrit range for it to be valid should be between 60.3 to 66.3. Since our hematocrit value is only 59.1, we can agree that there is an error regarding the patient's RBC indices because the hematocrit value is not 3 times the hemoglobin value. The invalid result of our rule of 3 indicates that the RBC morphology should not be normal. This result agrees with what we discussed in the previous slide, since there is an increase in hemoglobin and hematocrit. Again, with our values showing inconsistent results, our group decided not to report and do a peripheral blood smear to ensure the RBC morphology is correctly reflected in what was released in the result.
Since our group already decided not to report the result, we must do something in order to correct it, right? So the reason is to actually give a result that is accurate to what is really happening in that patient's health in order for the physician to diagnose correctly. So let's start with the first error, which is having too high hemoglobin levels. So as mentioned before on the previous slide, there are possible reasons why it is high, such as exposure to silica may it be caused by the environment the patient live in, and or it could be that the patient is a smoker. The reason again why these are the possibilities is because of the presence of the malignant neoplasm in the bronchus. So in order to verify this, we can check for the patient's past records to cross-check. If one will question, what if it is from the another laboratory or hospital? Because if it is in the same hospital or laboratory, then it is easier to access those past records. So the answer is health information systems. Most are already computer-based, and this will verify if the cause really is either of the two mentioned earlier. And then reminder, we can't ask the patient directly since we are not physicians and it is far from our job to do so as future medtechs. So moving forward to the second error is about the inconsistency of the RBC indices to hemoglobin. Again, mentioned in the previous slides that hemoglobin is increased, but in the table, RBC indices, specifically MCHC and MCH, were in the normal range. To correct that is to do PBS or the peripheral blood smear to see if it is really as what is imposed in the result. This error is connected still to the previous error because of the increased level of hemoglobin.
So to continue to the next slide, still it is about the RBC indices, but this time it is regarding the MCV compared to the results from the hematocrit. So again, it was mentioned a while ago, the reason for this error is the checking of the rule of 3. Similar to the previous error, we are still going to do the peripheral blood smear in order to check it microscopically. And if what is reflected in the result can be seen in the patient sample. So the fourth error is the rule of 3. Again, still verifying it through the peripheral blood smear.
Okay, so now let's go back to the CBC results. Since we've already dived in deep on the hemoglobin and RBC indices results, let's take a recap on the remaining parameters. So the white blood cell count is elevated since it exceeded the upper normal limit normal of 11.3. This increase in white blood cell is expected in cases of bronchogenic carcinoma. Next is the red blood cell count is elevated since it is more than the upper normal limit normal of 5.9. So is this increase expected? So remember that the patient has bronchogenic carcinoma and one of its leading cause is smoking. And remember that smoking may increase the RBC count. Thus, if we take into consideration that the patient's disease is secondary to smoking, then the increase in RBC count in this patient is valid. Next is we have the hematocrit is elevated since it exceeded the upper normal value of 50.4. Again, similar to the previous explanation, if smoking is the cause of the disease, then the increase in hematocrit level is expected since smoking increases the hematocrit level. Then lastly, if we have the platelet count, the value is 313 and is normal since it fits the normal rate. After reading the journals with similar cases, a normal platelet count value is common with this disorder.
So again, to sum up, we first need to dig deep as to why the hemoglobin levels are high for the 61-year-old patient. And then we cross-check it with his history. And then we validate it with the peripheral blood smear and then to check the RBC indices. So doing this is a must to arrive at the conclusion whether to release, reject, or investigate the results. So because if it is really caused by those reasons mentioned a while ago, then it might be correct to release the results. And then if not, then there is really a problem with the results. And then that ends our report for today. Again, we are the group 5. Thank you for listening.